Hey everyone, I'm Mike Jones, and you're back here for another one of our Medical Exercise Training 101 ebook tips. This is tip number 21. So if you don't mind, I'm going to read the tip, then we'll talk about it. But please make sure you get your free copy of the MET 101 ebook by going over to MET101ebook.com. Download it. It's a free PDF, and I think you'll find there are 101 tips there that will help you build your medical exercise training practice. Whether you're a fitness professional, medical exercise professional, or a physical therapist or chiropractor that wants to add this to your practice, this book will help. It's based on the 101 most common questions we've received over the last 30 years at the Medical Exercise Training Institute. So if you don't mind, let me read this. Number 21. What types of programs should I offer in my MET practice? Which programs to offer is the most important question for most MET practices, but it is also the most difficult. If I were starting out, as in me, in addition to 101 MET services, I would immediately start a dynamic back school and or a hypertension, diabetes, and obesity training program. You will find these programs are great marketing tools to develop referral relationships with physical therapists, chiropractors, and physicians, as well as attracting clients from the community. Your dynamic back school should include instruction on proper lifting mechanics and discussions on anatomy and pathology of the lumbar region. In addition, each dynamic back school session has a supervised exercise component focusing on lumbar flexibility, stability, upper and lower extremity strengthening, and cardiovascular training. The hypertension and diabetes program includes group training in addition to lifestyle education to help the client manage their condition. These are both 4-week programs you can offer in conjunction with your MET services, your 101 programs. Physicians, insurance carriers, and clients like the idea of finite exercise programming, specific number of sessions, focus on a specific condition or region, inclusive of a lifestyle education component. Folks, the physicians, the therapists, the chiropractors, nurses, we're so inundated in practices now with all the insurance paperwork, the number of patients that are coming in. We need someone to help us follow up on that lifestyle education component that we sometimes don't get a chance to do in detail, as well as someone to follow through and develop safe and effective exercise programs. Folks, this is a slam dunk in getting referrals. Please, if you would, let me continue. I will later phase in a women's fitness 101 program and a total joint replacement arthritis training program. Then market the women's fitness 101 program to OBGYNs and family practice and general practitioners in your community. Next, I would make every orthopedist, every physical therapist, and home agency in the community aware of my total joint replacement program. Folks, for our female population, they're having children after that. Hey, they've got this 5-pound bundle of joy. They've got to pick up and move around. Maybe they don't have the upper extremity strength for it. Or with that, they've gained a lot of weight. They've also had a surgical procedure in some instances. They need some rehab to get them back. Maybe they don't need ongoing physical therapy after a period of time, but they need someone to help them in managing this new bundle of joy they had. And for those individuals that have had total joint replacements or are supposed or looking at having total joint replacements, do we need a program to get them up to speed, that prehab program? And then after physical therapy is done, do we need a program to help them transition back to their full functional capabilities? I'll give you an example. We've had tons of patients over the years in our PT clinics, little old ladies and men that have the hip replacement done or the knee replacement done. They can walk on level surfaces. They're back to what they're doing, but they'll tell me, hey, Mike, I want to go back to church. And, I got to walk up the stairs to get to the church. It's a rather high climb, when I go up the stairs. I don't want to go in the side door. I've been at this church for years. I want to go in the front door. Or the people that tell you, I want to go back and shop. I want to go back and do things. And they got me well enough that I can do stuff and get out of the house, but I can't walk in my grandson's backyard. I can't go out on the picnic with everyone else. That's where the total joint replacement and arthritis program comes in. It's for those individuals that have had total joint replacements, or they're getting ready for the total joint replacement and they just want to get stronger so they'll have a better outcome. This is an area that you can do well in. So if you don't mind, let me continue. You can develop other programs for medical conditions you commonly manage. We call the programs, as I've noted above, our MedFit group training. Now, if you'd like to purchase any of our programs, go to www.medfitgrouptraining.com and you can actually purchase the programs. We'll actually customize them and put your logo, your name on it. It comes with a slide presentation, the exercise outlines, and everything that you need. Use the format and information presented in these programs for group presentations, as well as you can use it for one-on-one MBT clients. The concept of exercise plus education is extremely powerful. In our information overloaded world, the need for someone to clarify information and promote proper exercise is very much needed. And folks, you're going to see when you actually download the ebook, we actually have an equation here. Exercise plus education equals positive functional outcomes. So let me conclude. And let me mention one thing about medical referrals. Medical referrals are personal. Get to know the medical professionals in your community. Don't just simply ask them to refer to you. Ask them what exercise programs and services they need to better manage their patients. They won't give you specifics, but they will share general concepts. Use these bits of information to help develop medical condition-based exercise programs that are finite, outcome-based, and flexible to use with both individuals and groups. Our MET protocols serve as the basis for our MedFit group training programs and everything that we've mentioned above. Now, folks, the need for medical exercise training will continue to grow over the next 2 decades because of the baby boomers. There needs to be that bridge between healthcare and transitioning these clients out to safe and effective exercise programs. With that, we need someone also to give lifestyle education, to reinforce what the doctor, the therapist, the nurse have told these clients. Because, folks, I can tell you, I've had patients over the years that you'll say, Mr. Smith, I want you to do this twice a day. And Mr. Smith says, oh, I thought you said, Mike, twice a week. Okay? Doctors and therapists tell these folks, they just forget. They're overwhelmed. They've got so many things going on. And in many instances, it's the white coat syndrome. So we need you there. MedFit group training programs where we provide education plus exercise in a finite period of time. Maybe you see the client twice a week for the first 2 weeks, once a week for the third and fourth week. That's a 4-week program or 30 days. The reason we emphasize the idea of 30 days, for most medical providers, they're going to give a client a medication or a treatment for a 30-day period, then have the individual come back and see if that is working well. No, you're not providing any treatment, but in this situation, that MedFit group training program, whether it's hypertension or diabetes, whether it's total joints, whether it's the dynamic back school, whether it's the Women's Fitness 101, we're going to use that as a means of improving the client's level of function for 30 days. At the end of 30 days, guess what? The smart medical exercise professional says, I have a level 2 program where we're going to learn more lifestyle education components. And along with that, we're going to amp up the exercise a little bit to give it a little bit more juice, for lack of a better phrase, so you can get out and do more things. Folks, the healthcare system needs it. The clients need it. And most importantly, the fitness industry needs it to give itself more credibility. So with that, if you would please go over to MBT101ebook.com, download your ebook. Also, I encourage you to go over to our Medical Exercise Specialist Network. Check out the network, go over to mesnetwork.org to get more information, because we need to collaborate as medical exercise professionals and produce guidelines and protocols, as well as standard operating procedures, so we now have a profession instead of just simply a side hustle for trainers to get more clients in charge a little bit more. So with that, thank you for watching, and please make sure you subscribe and download the ebook so you can get more tips along the way. All the best. Take care.